And welcome back to our show. Dr. Larry Reeves and esthetician Jennifer Schumacher are here in the studio with us now, and they're ready to answer your questions. If you would like to, you can call us at the phone number you see on your screen. That's 1-877-982-3434. Center for Aesthetic Surgery, Dr. Reeves. Larry, how are you?
Good. How are you?
Tell me a little bit about the center.
Center is a full-service plastic surgery center. We provide both operative and non-operative procedures. And there's myself, there's two facial plastic surgeons, Dr. Jesse Smith and Yadra Duchik. We try to address all of the avenues of plastic surgery. And what we've seen over the last decade is that plastic surgery's changed, and in addition to the usual operative procedures that they sometimes want to enhance their appearance in between those procedures. And so those are the non-operative procedures that people are familiar with, the so-called fillers, the Botox, which is the neuromodulators. Those are the huge expansion that we've seen in plastic surgery in the last decade, probably becoming the most common procedures that patients are having.
I think most people have heard of Botox and things like you're talking about. And Jennifer, you're involved here as well. You do something a little differently. What does an esthetician do?
Well, I would make you look beautiful.
Well, hey, I mean...
I offer several different treatments at the Center for Aesthetic Surgery. Microdermabrasion is one of them. Chemical peels, IPL, which is a impulse light therapy. It helps with sun damage. Facials.
So if I wanted anything from just a facial to come in and relax and feel good about myself, or a full facelift, I could come in and see you all and you would take care of me.
Yes.
The phone lines are open. If you aren't able to get through, you can keep trying. Ben from Mesquite is on the line right now. Ben, go ahead with your question.
What procedures do you specialize in?
Well, we just kind of touched that, but we can run over them again.
I think that from invasive procedures, you're talking about facelifts, blepharoplasties, those type of things. From body type procedures, almost all the full gambit of breast procedures, whether it's an enhancement with an augmentation, whether it's a lift with or without an augmentation. Sometimes you're talking about liposuction, you're talking about all the different types of variations on that. You're talking about abdominoplasties. So it's pretty much the full gambit of plastic surgery.
I'm sure that your practice is like every other type of medicine. There's new things coming along all the time. What's the latest thing that maybe people don't know a lot about?
The biggest and probably the newest thing that people may or may not have heard about is the different use of what they call fat grafting, or taking fat, removing it from one portion of the body and putting it in other portions of the body and using that to enhance. And the key is being able to get that to last long term. But when you do, you can fill in areas. And I think the one thing that we're starting to see is that it's not necessarily just taking away, but it's actually putting things back to enhance the appearance, or to fill out the face, or if it's other portions of the body, to fill it out. But more commonly, we use fat grafts a lot in the face now when we're doing facelifts and things like that, to fill in areas even after you do your facelift, to enhance the appearance of that.
And I would imagine, since that fat, so to speak, is coming from your own body, you don't have a rejection problem, right?
You do not have a rejection.
Fantastic. Again, if you have any questions, please feel free to call us. The number is 1-877-982-3434. Kevin is on the phone from Fort Worth. Kevin, what can we help you with?
Yeah, I was wondering, can you treat sunspots with a chemical peel?
You can, to some extent, treat chemical spots with a chemical peel, but sometimes we may refer you to the esthetician and let them begin to treat you with some of the techniques. And I may let Jennifer touch on that a little bit, on things that you might want to
Chemical peels are great for treating sun damage. They also help with fine lines and enlarged pores. They help even out your skin tone, so it gives your skin a really pretty glow. They're also great for the hands and décolleté.
Now, Jennifer, if you have this done, is it a problem to go back out on the sun after it's over with, or not?
It depends on the percentage of the chemical peel that we use. Typically, you can. You'll have a little bit of peeling like you've been out in the sun, but nothing that's going to make you want to hide.
But you do need to kind of cover up and make sure you use a high SPF.
Yes, sir. Yeah,
okay, great. Thanks a lot for the information. Again, if you have any questions, we'd love to hear from you. That phone number is 1-877-982-3434. Now, I want to talk a little bit more about some of the things that you do, Larry, with people who have had accidents. Most of us think about somebody that comes in, I want a facelift, help me out. But you work with a lot of people that have been in really terrible accidents as well, don't you?
Yes, sir.
What are some of the things you run into?
Well, from things like basic things are like people that have bad dog bites on the face will get involved in that. People that are involved in bad automobile accidents have large fractures of their lower extremities and lose a significant amount of tissue over that lower extremity. Used to be in those situations we were faced where they were going to end up losing their leg. We now have the capability, we can take tissue from one other portion of their body, move it around, use it to reconstruct that lower extremity, preserve that coverage over the bone where they've done the big reduction of the fracture, and so then we preserve the leg and the function in that leg.
Let me ask you a question about breast implants, because I think that's probably one of the more popular things people have done. A friend of mine once told me that the nipples weren't quite where they straight on, I guess you would say, or aesthetic. What happens? Can you still have an implant, or does that create a problem?
In fact, one of the things we tell people when we first see them and have a discussion with them is that most of the women that I see for breast augmentation are asymmetric. And I try to talk to them and tell them that that's the most common thing I see. In fact, if I see somebody that is symmetric, that is the exception rather than the rule. So the woman that has some asymmetry, and normally what we see is not, they're both equally different than pointing straight on, but rather outward going, we'll talk to them and we'll say, this is a situation where you have one that's more towards the outside. And what's going to happen is when they get that implant, they're going to have an enlargement. They're going to have an asymmetry that may be a little more enhanced, one side compared to the other. But certainly they can have that implant.
Dr. Reeves, Jennifer, thank you so much for being with us today. A lot of good information. And again, if you would like to get more information, it's real simple. You can go to the phone number, 1-877-982-3434. We'll be right back with more. And this is going to be really good with Dr. John Sankowski for your questions on vascular and endovascular surgery and wound care.